families are facing new financial challenges due to COVID-19. The Child Care Scholarship Program provides financial assistance with child care costs to eligible working families in Maryland. Learn more at moneyforchildcare.com. State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to a special edition of State Circle featuring highlights of our recent programs. Coming up, the other epidemic, how the COVID-19 outbreak affected the opioid crisis, and why our state parks had a banner year. But first tonight, the many factors making certain communities more susceptible to the coronavirus. We spoke with Dr. Sharita Hill Golden, Chief Diversity Officer for Johns Hopkins Medicine.
When we think about the disproportionate number of deaths, it's really highlighted in the figures that you just mentioned, that the percentage of deaths are even higher than the proportion of, African Americans, for example, who are in the state of Maryland. So it's out of proportion to the size of the population. And I think, when we were speaking last, we talked about the contributors to those disparities. Some of those things are related to the health system experiences and the medical and scientific experiences. So there's been distrust in the medical establishment because of historical practices of experimenting on slaves and other minoritized groups. And then, of course, like the Tuskegee syphilis experiment, when treatment for syphilis was withheld in African American men to learn the natural history of syphilis. So many communities still remember that. And then there was the eugenics theory that purported that there were certain groups that were biologically inferior to others. And we know today that that has no scientific foundation, but unfortunately, some of our clinicians may still perceive certain populations to be less intelligent, less likely to follow care recommendations. So there can be a biased experience in the healthcare system.
And there's so many other things. I mean, there's the general access to quality care, the number of people from minority backgrounds who are in the healthcare profession. You get into people who maybe work more often in public-facing jobs, maybe ride public transport more often, have multi-generational learning, living arrangements, thinking about urban pollution and higher asthma rates. It's a long list.
It definitely is. So what you've just outlined are what we traditionally call the social determinants of health. And so these are conditions in which people live that influence their health as well as their healthcare access. So, one, of course, is healthcare access. And then once you access the system, we talked a bit about what contributes to maybe that inequitable quality of care. But then, poor housing conditions that resulted from historical practices of redlining and lack of economic investment in neighborhoods really has resulted now in spaces where not only is there housing instability, but there's a lack of green spaces and parks for exercise. And then there's also a lack of healthy food access. So all of these things increase the risk of chronic diseases. And then, of course, there are the increased risk of COVID exposure from social determinants of health. So if you have transportation challenges, as you mentioned, and you have to ride public transportation, you're more likely to be exposed to COVID. And we know that racial and ethnic minorities are more likely to be in jobs that require them to be on the front lines and essential, but then they may also be less likely to have the transportation to get there, so they're relying on public transportation. So that just created a perfect storm. The same social conditions that contributed to disparities in chronic health conditions also contributed to disparities in COVID. And so, this is sort of the perfect storm that's been created, unfortunately.
If there's any good news, I mean, there's wide awareness of the problem now, and maybe an opportunity to do something from a short-term perspective, long-term perspective. What do we need to do?
I think, there's two things. So one of the things that I work on in my current role, of course, are the things within the health system. So how can we, make sure that not only do we have unconscious bias training for our providers, which to me is just scratching the surface, but then to make sure they understand the manifestations of structural racism, how that manifests in healthcare and government and education and housing, because all of those things impact health. And then how can we make sure in our healthcare system that we're implementing the class standards, which are the culturally and linguistically appropriate standards. So making sure there's interpretation services, translation services, all of our education is literacy adapted. And then there's the making sure that our workforce, our biomedical workforce, is diverse. And so that's another big area that my office focuses on, is workforce and our diversity in our physician workforce, our nursing workforce, anyone who touches the patient, because that is ultimately going to result in those life-changing decisions. I say that diversity and inclusion in healthcare is a matter of life and death, because our biased decisions can ultimately harm a patient. And so that's why we need to have a diverse workforce to address that.
It seems like at our taping time, it's likely that a COVID-19 vaccine is going to become available to the general public in the early part of next year. Ensuring access to the vaccine within minority communities and addressing some of the things you talked about with the experimentation that has left a longstanding, bad taste among people of color. How do you overcome that? What are you thinking about in terms of trying to ensure that there's equal access to the vaccine and equal uptake of the vaccine?
Right. So those are probably the hardest barriers that we have to overcome, and, really sort of bending the curve of the pandemic again and hopefully ending it. And so there are two vaccines that one is being evaluated by the FDA tomorrow. They will make a decision on whether they will issue an emergency use authorization, and then the second vaccine next week. So, we're really sort of days away in a lot of senses. And so what's really important, I think, first is to acknowledge that we understand why it is that you are distrustful or uncomfortable with the medical establishment. But at the same time, it's the same community that is disproportionately dying from COVID-19. I doubt that there's an African American in Maryland at this point who doesn't know someone that's had or died from COVID. And so in that context, then we have to really make sure that the community is properly educated, that the myths are dispelled. One of the concerns I've heard is that this is a new technology and it hasn't been used before. The technology is the first time we're using it in a pandemic caused by coronavirus, because this is the first time that's come up. But that technology has been developed over about 9 to 10 years. And in fact, the scientist that's been leading the group at NIH overseeing that technology development is an African-American scientist, Dr. Kizzmekia Corbett. So I think these are all important things for our community to know so that they can make informed decisions, and have an opportunity to ask questions. So we'll be partnering with our trusted community messengers, often the faith community, the civic partners, to really help us in that messaging and in education for the community.
Your role at Johns Hopkins, one of the world's great medical institutions, located both campuses in communities in East Baltimore that have a lot of challenges. To what degree does your work focus inside of the institutions, and how much is focused outside?
Well, it's an interesting question, because the majority of our office, we're the Office of Diversity, Inclusion, and Health Equity. So we're very focused on our internal work. So we want to make sure that not only is our workforce diverse, but that it is inclusive, that people can bring their full selves to work. Because when we have a really inclusive and rich environment, we can give the best care to our patients. And we focus on the health equity operations. But, I would say that at least my faculty appointment is in the Department of Medicine, and at least 25% of our staff live in the zip codes around Johns Hopkins Hospital and Johns Hopkins Bayview Medical Center. So in fact, our community is working with us inside of our walls. And so really what's particularly important is that we've got to make sure that they feel engaged and well respected within our walls, and then they can be our ambassadors outside in the community. So I think that's an important piece. But the other external piece that my office focuses on is that we partner a lot with our government and community affairs office. And so, we're very much concerned with supporting advocacy efforts at the state level to address some of the social determinants of health that we talked about earlier. So, legislation to really address affordable housing, healthy access to food, all of those things that are truly impacting health. And so we've been partnering with colleagues and allies in the Maryland legislature. And I know in the January session, they will introduce some health disparities legislation. So that's sort of the outward facing role that my office has as well.
Dr. Sharita Hill Golden, joining us from Johns Hopkins. Doctor, nice to see you. Appreciate the time.
Thank you. Thanks for having me again.
The pandemic has been causing deaths indirectly too. In September, we spoke with Steve Hsu, Executive Director of the state's Opioid Operational Command Center.
The first quarter rate of increase was about 1%. As COVID began kicking in, we started to see the beginnings of an acceleration in the number of fatalities. But when COVID hit with its full fury in the second quarter of the year, April, May, and June, the number of fatalities in Maryland increased by 18%. Very, very alarming. Now, to put that in context, other parts of the country are seeing even worse increases of fatalities, including our neighbor state of Delaware, which recently reported a 47% increase in fatalities during the first 6 months of the year. So that tells me that our responses, our actions to mitigate the acceleration in the number of fatalities is working here in Maryland, but we clearly have a lot of work to do.
What's the mechanism by which the coronavirus epidemic causes an increase in opioid deaths?
People who suffer from substance use disorder are very vulnerable. They have a vicious disease that is always on the attack. And people who suffer from that disease require support in their recoveries. COVID has the effect of disconnecting people from those support services, from their counselors, from their AA or NA meetings, from their support systems generally. Job loss leads to despair, and despair leads people to misuse substances of all sorts, not just opioids, but all classes of drugs. And that is what we are seeing in the numbers. All classes of major drugs of misuse are increasing with respect to the number of fatalities in Maryland at very alarming rates.
The big one is still fentanyl, the synthetic opioid?
Yes, synthetic opioids, primarily fentanyl, are the most dangerous substance that we see. Opioids account for about 90% of all substance-related intoxication deaths in Maryland, including from alcohol. So 90% of all deaths in Maryland are from opiates, but within the opiate category, 93% of those are the result of fentanyl. But it's not just opiates. It's important for people to understand that about 68% of the fatalities in Maryland from overdose also involve a non-opioid substance. It might be cocaine, benzodiazepines, methamphetamine, PCP, or alcohol. But there is 68% of the time another drug involved. Polysubstance use, as we call it, is becoming increasingly common. And it's very important for people to understand there is no such thing as a safe street drug. Invariably, all street drugs are now being mixed with fentanyl, and fentanyl will kill you.
Where do you stand in terms of the resources that you need to attack this problem?
Maryland has come a long way over the last 4 years. If you go back 4 years ago, if you were a person with substance use disorder and wanted help, it might take you 3 or 4 weeks to get into a treatment program because there was so little capacity. That has changed utterly in most parts of Maryland. If you want help and you need to go into treatment, you can probably get into treatment that same day or the next day in all likelihood. Now, when the governor and lieutenant governor saw the number of fatalities increasing in March, April, and May of this year, they sprung into action and instructed our office to develop an action plan, which we published in June and is available on our website, to confront the opioid crisis and substance use issues of the state, even as we continue to combat the COVID pandemic.
What do you see with the numbers into the third quarter, if you can talk about that yet? As the coronavirus pandemic has maybe gotten a little bit more under control, society's reopened a little bit, is that helping?
It's too early to say. We do not yet have numbers because toxicology takes time. to understand the causes of any death in Maryland, whether drug-related or otherwise. And we won't know for some time how things shape up in the third quarter.
Leslie, I was going to say, if somebody's watching and either, they know they have a problem, they have a family member who has an issue, what's your best advice for getting help?
There are many ways to get help, and they're very easy. You can always contact your local health department. Someone will help you. You can go to my office's website, beforeitstoolate.maryland.gov. Lots of resources there, but the easiest way of all is just simply dial 211, press 1. Anywhere in the state, you can dial 211, press 1. A caring and knowledgeable operator will answer that phone and connect you to the resources you need, whether you're a family member or someone suffering from substance misuse. They will be able to help you at 211, press 1.
Steve Shoes, the Executive Director of the Maryland Opioid Operational Command Center. We appreciate the time.
Thank you for having me. And
State Circle continues after this.
Can you tell us what you know?
Turning back now to the race for the White House.
The State Board of Elections voted Thursday to set up a new election.
It must be a very emotional day.
The world changed in the blink of an eye.
Children are at the heart of this story.
The pandemic caused many people to delay big vacation plans, and many wound up traveling closer to home. That was evident in Maryland state parks, which have recorded at least a 15% increase in visits. We spoke in October with Park Service Superintendent Nita Satina.
When, everyone realized that social distancing and traveling and other leisure activities became restricted in March, we saw an immediate increase in our visitation as people took heed of the advice to either stay at home or be outside where you can practice social distancing. And our numbers started to climb in March and have been at record numbers ever since. So we are at 17.1 million visitors for 2020. Our last record visitation was in 2019. We had a total of just under 15 million visitors. So we're already at 17 million with several months left to go in the year.
Did it cause any problems? Did you have crowding at any of the more popular parks?
Probably the biggest challenge we had with the increase in visitation was that we did have, about a little over a dozen parks that routinely throughout the summer filled to capacity on the weekends. So, so that means that we had over 260 parks filled, or 260 times rather, that we filled to capacity, which means that we have to turn folks away when they come to the gate. So that was a challenge, but I think a lot of people started to discover some of the other parks that were less visited as well. So.
Yeah, that's exactly what I was going to ask about. If I hope the trend continues and the parks remain popular. I hope it's not because of the pandemic in 2021. But are there any parks that you would want to call people's attention to that are, I don't know if I want to say they're good substitutes for some of the more popular parks, but they're maybe lesser known and should be better known?
Yeah, I always like to talk about, some of the parks that are less visited than the most iconic parks that people might think about, like Assateague State Park and Sandy Point State Park, which are very popular parks. But we have 75 state parks in Maryland, 130,000 plus acres across the state. So there's lots of opportunity to visit parks that are beautiful and offer wonderful relaxation and recreation in nature that you might not have discovered yet. Some of my favorites, starting on the Eastern Shore, Janes Island State Park is a beautiful park in the southern tip of the Eastern Shore. I like to call it our Caribbean on the Chesapeake. Beautiful views of the Chesapeake Bay, camping, and world-class kayaking in a salt marsh there, and white sandy beaches to enjoy. Lots of great birding this time of year. So fall is really my favorite time to go to Janes Island State Park. And then you have the local town of Crisfield, the city of Crisfield right there as well. So if you're looking for a good crab cake and that sort of thing, nice restaurants there to enjoy. Another favorite on the Eastern Shore is Pocomoke River State Park. Beautiful state park that preserves the northernmost reaches of a bald cypress swamp on the Pocomoke River. Beautiful camping, paddling, fishing, and growing trail system as well.
Do you want to give us one other maybe in another part of the state?
One of my favorite places in southern Maryland is called the Merkel Wildlife Sanctuary on the Patuxent River. Fall is a particularly beautiful time to go there. It preserves the greatest concentration of Canada geese that migrate here in the fall and winter to Maryland on the Western Shore. So if you want to see lots of ducks and Canada geese and enjoy some hiking, Merkel Wildlife Sanctuary is a beautiful destination.
I do wonder if all of the activity that you've had this summer maybe took away some of the attention that you could pay to long range projects. But what are some of the things you're working on over the next couple of years?
So in the next few years, we have some new state parks actually coming online that we're excited about. So one of them is called Wolf Den Run State Park in Garrett County in Western Maryland. It will be our first off-highway vehicle state park for ATVs, motorcycles, Jeeps, that sort of thing. 2,000 acres of rugged trails. So we are in the process of opening up to 40 miles of new off-highway vehicle trails in that new state park. We also have in the same Garrett County, Sang Run State Park that has opened on the Youghiogheny River. Beautiful walking and historic sites to enjoy there. On the Eastern Shore, Bohemia River State Park and Cypress Branch State Park are coming online in early next year. So new state parks to grow our system, to address a lot of growing demand by the public for outdoor recreation.
Nita Satina is the Park Service Superintendent. Nita, thank you very much.
Thank you, Jeff. Thanks for having me.
And speaking of the outdoors, a piece of Maryland history is back in its rightful place on the water, as Sue Copen reports.
The crew of the Wilma Lee is getting things ready for their next trip out on the Chesapeake Bay. The skipjack, included in the National Park Service's Register of Historic Places, is finally home and ready to plow the bay's waters once again.
So we acquired the skipjack in June of 2016. We've spent the better part of 2 years restoring her.
The Wilma Lee was built in 1940. A lot of work went into the restoration.
It ended up that we needed a new mast, which was very significant, and many other just a whole laundry list of repairs that took the better part. But she's shipshape now and she's ready to go.
And now that she's ready to sail, the museum is preparing a whole curriculum for the students who'll be learning some first-hand lessons starting this fall.
We're going to take kids out out into the bay, and they can go to the reef. We're going to also do things like water quality off the boat. We have a dredge where we'll dredge and pick up animals, and they'll be able to see what's on the bottom.
Kathy Wasuta is the museum's education program coordinator.
Our museum itself is based all on oysters, so we like to focus on that, but we'll definitely take the kids out just for the experience of using a reel, boat that oystermen used and putting up the sails and learning about the different parts of the boat.
The museum is taking steps to ensure the safety for both visitors and crew.
For COVID, we are at half capacity. So the boat is Coast Guard certified to carry 47 passengers. We carry 23, including crew and captain. So we have demarcations where people can know that they are socially distanced.
Rick Flamand is the lead captain for the Wilma Lee.
I'll tell you, I have a sense of pride, a sense of responsibility, because it's a historic artifact.
Flamand says the boat attracts a lot of attention.
We get a lot of boats that come by and take our picture and ask us, is that a skipjack? And yes, it's one of 22 still floating.
The museum will also be offering the public the chance to ride the historic skipjack with heritage and sunset cruises. Flamand says he hopes a ride on the Wilma Lee will bring a new appreciation for the important role the skipjacks have played.
It's a piece of history. You don't want to forget it. You want to learn from it.
On the Wilma Lee, Sue Copen for State Circle.
Sue, thank you. That is State Circle for this week. Remember to follow us on Twitter and Facebook at MPT News. Now, for all of us at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
Met professor Teling.
Ik ben blij dat je het terug zegt. Hoe is het met hem?
Hij is zotter dan anders.
Die slachtoffers hebben niks met elkaar te maken.
Geen getuigen.
De zaak is opgelost.
Wat je meent dat of?
Sarcasme, dat vind ik leuk.
En jij bent echt onuitstaanbaar. Allee. Alles onder controle, professor?
Absoluut.